Welcome to Askimo TV. We're talking today to Dr. Romesh Angunawela. Dr. Angunawela is a consultant eye surgeon specializing in corneal and lens surgery and laser eye surgery at Moorfields Eye Hospital in London. Hi, Dr. Angunawela.
Hi, Joanne. Nice to meet you.
Lovely to be talking to you today. Dr. Angunawela, we're going to talk about cataract surgery and frequently asked questions that people may have. So let's start off with What is cataract and who gets cataracts?
Well, a cataract is a change that occurs in the human lens, and that's usually a change that occurs as you age. In a younger patient or a person up to their 50s, the lens which lies behind the pupil is very clear when you look at it. And the lens structure is made up of various proteins that change over time. And as those changes occur, the clarity of the lens alters. So when you look at the lens in someone who has a cataract, it tends to look slightly yellowy. And as that becomes worse as time goes by, the lens becomes more white or opaque. And in fact, a cataract is essentially an opacity of the lens. Who gets cataracts? Well, generally, cataract formation is an age-related phenomenon, and it's usually something people get as they get older, into their 50s or 60s. But even younger patients can get cataracts if you've been taking oral steroid tablets, for instance, that can precipitate a cataract to occur earlier. If you're diabetic, you can get cataracts earlier. And in some cases, children are born with cataracts. So, in fact, you can get cataract formation at any point in your life. Trauma can also cause cataracts. So if you've had a bang to the eye, sometimes years later, you may find that a cataract has developed. And it's really just a change in the protein structure of the lens, which makes it less clear and more difficult for light to pass through it. So the vision becomes blurry.
Under what conditions would it be necessary to operate? And what are the ramifications if I were to choose not to operate?
Well, the main reason for operating on patients with cataract is because they begin to notice that their vision isn't very good and they can't read as far as they could before. And the other thing they may notice is that the quality of their vision diminishes, and they notice more glare in situations where there's bright light around, or when they're driving at night. They notice halos or starbursts around oncoming headlights, or they notice that colors just don't look as bright, they look a bit washed out, and that they lose some of the contrast sensitivity when they look at, say, writing on a page. Those are the main reasons why patients come to see an eye doctor to consider cataract surgery. And these days, we tend to do cataract surgery on patients if they find that the problems they're having with their vision is interfering with their lifestyle. And that can vary between different patients. It's a very subjective thing. If they're very active and like to do a lot of sport and have visually demanding lifestyles, then they want to have their surgery done much earlier. And the opposite of that is, if they don't have very active lifestyles, they can generally tolerate having some cataract for a longer period of time. If you don't do cataract surgery, you're essentially postponing the inevitable. I mean, cataracts are something that we will all get, and they gradually get worse over time. And the more advanced the cataract is, the more energy is required to remove it. Having said that, in Western countries, we generally don't encounter very advanced cataracts because people have their cataracts removed at an earlier stage. But in developing countries where cataract services aren't available, very dense cataracts can be difficult to remove and require a much bigger operation than the keyhole surgery that we now do.
So tell me a little bit about the keyhole surgery that you do to remove the cataracts.
Okay, well, a cataract is essentially a change in the lens, as I've mentioned before. And the lens is around the size of an M&M chocolate sort of button. And it's very similar to an M&M. It has a sort of outer coating and a central soft area, which is the cataract part. The coating is what we call the capsule. And when we do cataract surgery, what we're trying to do is we're trying to remove the chocolate from the inside of the M&M, or the nucleus from the cataract essentially, and leave behind the capsule. To do that, we use very tiny instruments to tear a little window in the capsule that allows us to sort of access the nucleus of the lens. And we're able to then divide that nucleus up a little bit like you would cut up a pizza into more sort of manageable pieces. And we use a machine called a phacoemulsifier, which is a very high-speed ultrasound device that emulsifies the lens and then sucks it up. So you don't bring out the big chunks. The chunks are actually broken up within the eye and removed. And surgery generally takes around about 10 minutes or less with modern sort of cataract techniques. The newest advance with this is to actually use a laser before you even come into the operating theatre to just soften the cataract and to make that little window in the capsule of the lens with the laser, which is extremely precise and cuts out many of the actual surgical stages that we have to do by hand otherwise.
What are the risks, if any, to this procedure?
Well, cataract surgery is actually generally very safe, but like all surgical procedures, it carries some risks. The risk of a complication that could lead to a reduction in your vision, and that means usually some sort of infection within the eye after the surgery or some bleeding during the surgery, is extremely small. And it's estimated to be around about 1 in 1,000 as a sort of national statistic. More common things that can happen are that you can sometimes get a membrane that grows over the artificial intraocular lens that we put into the eye, and that's something that happens in about 1 in 10 people. It's very easy to treat that. We do that in our clinics using a laser, so it doesn't require any further surgery. And once you've had cataract surgery done, you can't get a cataract again. That's it, because you don't have a natural lens there. It doesn't opacify. The artificial lenses last for decades and they don't need to be changed. So you'll have clear vision from that time onwards.
Thank you. Thank you so much for talking to me today.
Pleasure.